In the chaos of a crumbling, exorbitant U.S. healthcare system, one visionary leader spots a rare chance for transformation, and it's sparking debates you won't want to miss. For the first time in generations, everyday Americans are diving into earnest talks about healthcare from the grassroots level, igniting hope in Dr. Toyin Ajayi. And this is the part most people miss. She's not just optimistic, she's excited about the potential for genuine reform. We're at a pivotal moment where wellness, medical services, and the very essence of vitality have become central to a nationwide conversation, shared Ajayi, the co-founder and CEO of Cityblock Health, during a chat with CNBC senior media and tech correspondent Julia Boorstin on the latest CNBC Changemakers and Power Players podcast. Available at https://www.cnbc.com/2025/09/22/cnbc-changemakers-power-players.html. I've never witnessed anything quite like it, she added. Amid budget slashes for scientific studies, like the recent reductions to the NIH under Trump's administration, detailed in https://www.nbcnews.com/science/science-news/trumps-NIH-budget-cuts-threaten-research-stirring-panic-RCN 1917444, and Divisive Measures from Health and Human Services Secretary Robert F. Kennedy Jr., such as spreading vaccine doubts during congressional hearings, as covered in https://www.cnbc.com/2025/09/04/RFK-JR-spreads-vaccine-missinformation-during-congressional-testimony.html, plus intense political clashes over funding that led to the longest government shutdown in U.S. history, explored in https://2025/11/08/ACA-subsidy-cliff-government-shutdown.html. This optimism might seem utterly misplaced. But here's where it gets controversial. Ajayi insists that all this attention on our dysfunctional system is precisely what's needed to drive progress. Healthcare in America is outrageously expensive, and there's no logical reason for it, she emphasized. Despite pouring in vast sums, we're not seeing better health results as a nation. The U.S. outspends every other advanced economy on a per-person basis for healthcare, yet we lag with some of the worst outcomes. Medical professionals are utterly exhausted, doctors and nurses are quitting in record numbers, leaving the field depleted. We're struggling to recruit talented individuals for vital roles, such as primary care physicians in remote rural communities, where access is already scarce. And with our population aging rapidly, the demands are escalating. Clearly, the old ways were failing, and now everyone's fed up, she explained, painting a picture that's easy to grasp. Imagine a system where money flows freely but health suffers, leaving frontline workers overwhelmed and patients underserved. Ajayi, featured in CNBC's 2025 Changemakers list, as highlighted in https://www.cnbc.com/2025-Toyin-Ajayi-2025-changemakers.html, and part of the broader 2025 CNBC Changemakers cohort. See https://www.cnbc.com/2025-the-2025-cnbc-changemakers.html points to initiatives like the Make America Healthy Again movement as a beacon of hope. Regardless of my personal stance on some views held by participants, it's remarkable to see people rallying around wellness, she noted. It's fantastic that folks are organizing under a shared health-focused banner. This prompts questions like, who should I vote for to ensure my family and I can thrive healthily? For the first time in recent memory, genuine dialogues are unfolding not just in legislative chambers or government offices, but right in communities, debating the true meaning of good health. She elaborated, encouraging us to think about how grassroots movements might challenge traditional top-down politics. Cityblock Health specializes in delivering comprehensive care covering medical, mental health, and social support services, particularly for those on Medicaid, a government program providing health coverage for low-income individuals and families, or dually eligible for both Medicare, health insurance for seniors and some disabled people, and Medicaid. With over 100,000 members in more than 10 states, the organization deploys community health workers for localized home visits and care coordination, linking patients to essential resources like food assistance programs and transit services. Think of it as a personalized support network that meets people exactly where they are. With public confidence in the U.S. healthcare framework hitting rock bottom, as Ajayi describes, Cityblock prioritizes building and sustaining patient trust above all. She conveys this core message to her investors, stakeholders, and teams alike. For ages, healthcare has been dominated by a top-down structure, us versus them, said Ajayi, drawing from her experiences as a medical student and physician in diverse settings, from resource-strapped pediatric units in Sierra Leone to cutting-edge facilities in Boston. We professionals wore the white coats, hoarded the data, and relied on years of expertise, treating patients as mere subjects. That approach is obsolete. Now, we have a golden opportunity in medicine and public health to rebuild trust by truly engaging people on their terms, she urged. This translates to visiting homes, interacting via smartphones, or connecting through social media platforms. We must meet individuals wherever they are, using clear, relatable language that resonates, Ajayi stressed, making the concept accessible by imagining healthcare professionals as approachable neighbors rather than distant experts. She's enthusiastic about AI's role in enhancing this accessibility, making care more reliable and comprehensible for everyone. Cityblock is channeling investments into AI innovations to ensure government health program benefits reach underserved patients, not just the affluent, so that in a decade, we can reflect. As a society, we created AI solutions that improved lives for those often overlooked, fostering inclusivity that wasn't there before, she envisioned, perhaps sparking debate on whether tech like AI could widen inequalities or bridge them. Tune into this episode and every one of the CNBC Changemakers and Power Players podcast on Apple, https://podcast.apple.com/podcast/cnbc-changemakers-power-players/ID 18402092228 or Spotify, https://open.spotify.com/show/1zqqxtxrofgddmy4uqtez. CNBC welcomes nominations for the third CNBC Changemakers Women Transforming Business list. Details at https://www.cnbc.com/2025/09/3/changemakers-list-nominate-leader-women-transforming-business.html. An unranked honor celebrating exceptional women shaping the business landscape and forging new paths. What do you think? Does Ajayi's optimism about AI and grassroots movements represent a real solution to our healthcare woes, or is it just wishful thinking? Do you agree that political controversies are fueling necessary change, or do they risk polarizing the system further? Share your views in the comments and let's discuss.